let's have the most exciting man, Sir Desmond Swayne.
Thank you. Can I welcome wholeheartedly the announcements that have been made today? And I would ask the Prime Minister to review again the need to sack domiciliary workers and NHS workers, and to examine that evidence that suggests that they pose a risk to their statements, when our belief is that they won't any more than unvaccinated.
Prime Minister.
I thank him very much, but I think the evidence is clear that healthcare professionals should get vaccinated.
I hope the Prime Minister will forgive me for not being extraordinarily grateful for the withdrawal of these measures. I and many colleagues on these benches didn't think they were necessary in December, but I do nonetheless welcome their removal. Can I draw his attention to a further policy which I think it would be helpful if he reconsidered? The Government's current plan is to say to our valuable NHS staff that if they refuse to be vaccinated, they're to be sacked. And those sackings are to commence in a couple of weeks' time with no compensation. We know, and we know now, that the Secretary of State is being advised by his own officials, due to the lack of protection against transmission, that this needs to be rethought. Can I urge the Prime Minister to rethink this policy? We shouldn't reward our NHS staff for all their dedication with the sack. We should allow them to continue in the valuable work that they deliver to our great country.
Minister.
I thank him very much, and I respect very much the points of view that he's put across consistently throughout this pandemic, and it's been very important that we've had a voice speaking up for freedom in the way that he has. But I have to think also of those who will be at the bedside of elderly and vulnerable people who are dying of nosocomially acquired COVID, and their feelings about our failure to get vaccination rates up high enough within the NHS. And it's a very, very grim problems. I'm sure he can understand, Mr. Speaker. And nobody wants to have compulsory vaccination, but since the policy was announced, rates of vaccination within the NHS have gone up notably, and that's a positive thing. We will reflect on the way ahead. We don't want to drive people out of the service, but it is a professional responsibility of everybody looking after the health of others within our NHS to get vaccinated, and I hope he agrees with that.